We know that hair loss can be quite tough to deal with. It can feel embarrassing to talk about and can even feel like bottle after bottle of hair loss shampoo with no results. Here's some good news. Hair loss can be stopped, and it may even be possible to reverse it. Hi, I'm Dr. Preethi Jeyabal, Director of Regenerative Aesthetics, Hair Restoration and Dry Eye Services at Eagle Aesthetics and Surgery. In this video, we will learn more about hair loss and what you can do to treat this very common condition. But before we start, subscribe to Eagle Aesthetics and Surgery to learn more about aesthetic medicine, oculoplastics and even plastic surgery. Let's first talk about hair loss that's reversible, also known as non-scarring alopecia. It is as simple as noticing hair on your pillowcase when you wake up in the morning and can become as severe as developing bald patches on your scalp. There are various causes of hair loss, such as stress or nutrition-related hair loss, where you may lose hair due to sudden changes in your lifestyle, like sudden weight loss, anemia, or vitamin deficiencies. Second, hereditary hair loss, where hair loss may run in your family. This is also known as androgenetic alopecia, which usually results in gradual thinning over the crown of your head or frontal hairline. Number 3, autoimmune conditions or disorders where you may have another existing medical condition that has the side effect of hair loss. This may be known as alopecia areata, which causes patchy hair loss on the scalp or other areas. And number 4, it may also be caused by other disorders like collagen effluvium, which is a result of physical or emotional stress, illness, or nutritional deficiencies that can lead to temporary shedding. Number 5, related to habits or actions such as fractional alopecia, which is hair loss caused by repeated pulling, such as in high-tension hairstyles like ponytails or tight buns. There are many causes for hair loss, but these are among the most common reasons for this condition. If you are concerned about your hair loss and have scheduled a meeting with your doctor, here's what you can expect from your consultation. Your doctor may first take a detailed history, lifestyle review, and physical examination of your scalp in order to understand your hair loss timeline and patterns. This may require a scalp examination or even a hair pull test to assess if you are actively shedding hair and to determine if your hair loss is linked to other health conditions or scalp disorders. Depending on your condition, a trichoscopy may be needed. Trichoscope is a type of non-invasive scalp imaging tool that magnifies your hair and follicle structures, which help to identify patterns of thinning, inflammation, or scarring. During this procedure, your doctor will be looking out for signs of hair shaft abnormalities like broken hair shafts, miniaturization, exclamation marks, or follicular abnormalities like empty follicles, inflammation, or black dots. A blood test may also be done to check for any hormonal imbalances, nutritional deficiencies, or autoimmune markers in order to rule out any other possible causes for your hair loss. All of these tests are done to identify the underlying causes of your hair loss, as a clear diagnosis is the foundation of your treatment plan. So, what kind of treatments are available for hair loss? First, we have your topical prescription products for hair loss. This can include products like minoxidil, which is a potent ingredient for hair growth. This can come in the form of liquid, foam, or a spray that needs to be applied to your scalp every day for at least 6 months in order to see results. Or it can be DHT inhibitors like finasteride, which is usually taken in oral form. Beyond this, you may opt for specialized hair rejuvenation treatments to help treat your hair loss. These treatments can be used in conjunction with other medical therapies for enhanced results, or can be an option for those looking to rejuvenate their scalp and prevent further hair loss. Depending on the severity of your condition, you may opt for treatments such as microneedling, which uses tiny, controlled punctures to trigger the scalp's natural healing process. This helps to enhance blood circulation, encourage collagen production, and improves the absorption of topical products such as growth factors or serums. Second, LED light therapy, where specific wavelengths of light such as red or near-infrared light are delivered to the scalp to energize the cells and reduce inflammation. This helps to improve hair follicle vitality and has been shown to extend the growth phase of the hair follicle. Next is fractional non-ablative lasers. These create microthermal zones in the scalp, inducing wound healing response, which results in release of growth factors and cytokines. It improves vascularization and stem cell activation around the follicles. By doing that, it promotes transition of follicles to growth phase, eventually increasing the hair density, thickness, and shaft diameter. The final one is Trichopad hair loss system. This is a newer type of non-invasive scalp therapy that combines a variety of procedures like micro-incisions, electrostimulation, iontophoresis, shock waves, and even LED light to stimulate the hair follicles and improve the scalp circulation. This can help to enhance the active ingredients, creating the ideal environment for hair regrowth to happen, and helps to slow down hair thinning in its early stages itself. These treatments are usually combined with application of serum with growth factors or exosomes that's specifically meant for hair to produce enhanced effects and better results. Your doctor will be able to help you narrow down the right scalp treatment for your unique condition once they've identified the root cause of your hair loss. By rejuvenating your scalp, scalp, it can help to support the overall health of your hair and reduce shedding. And now for the million-dollar question. Can you reverse hair loss? The answer is yes, as long as you do not have scarring alopecia. As mentioned earlier, most people have non-scarring alopecia, which is hair loss caused by stress or other medical conditions. In this case, the hair follicle is still alive, making regrowth possible when treated in a timely manner. However, scarring alopecia is different, as it can cause permanent follicle damage. In this case, no amount of treatments can help to regrow your hair. If it is caught in the early stages, it is possible to slow down and even reverse the early stages of scarring alopecia with medications such as steroids and supportive therapies to maintain scalp health. Don't let your hair loss defeat you. With a wide variety of treatment options available, it is possible to stop your hair loss before it's too late. Have more questions about scalp rejuvenation and hair loss? Leave us a message at Eagle Aesthetics and Surgery, and we'll be happy to help.